Okay, over the break, how much did you guess? If you guessed $29 million, bingo, you win. Because that is how much you American taxpayers just spent on prescription drugs, drugs for people who are in the United States illegally. The Hill's Elise Viebeck joins us with more. Nice to see you, Elise.
Hey, Greta.
Okay, so who did this report?
This was the Inspector General's Office of the Department of Health and Human Services. So these are federal investigators investigating the federal government. And what they found is that from a period of 3 years or so ago, the Health and Human Services Department under Medicare Part D was paying for prescription drugs, reimbursing insurance companies for people who were not here legally.
Knowingly?
Knowingly, as far as we know. I mean, well, no, they didn't have policies in place that would have caught these people or vetted them one by one in terms of their immigration status. The way Medicare Part D works is people have their plans offered through a private insurance company, and then those insurance companies bill the federal government. And so the federal government was effectively paying insurance companies on behalf of patients that apparently the insurance companies hadn't vetted extensively enough. They thought they might have been eligible for Medicare, but they weren't because they're illegal immigrants.
All right, what I always love is that it's always like a 2-year, 3-year program, so I'm always curious is, are they doing it right now?
They may be doing it right now because this report came out fairly recently and it was for several years ago, so now they're just starting to put policies in place that would catch this in the future. I think what this shows is that Medicare Part D, which is a newer part of Medicare than A and B, which cover hospitals and doctors, although those have the same problems according to other investigative reports. But Medicare Part D is fairly new and they didn't have policies in place that would have caught these. I think the federal health officials thought that illegal immigrants or residents would have been caught when they tried to use A and B services, and that would have ultimately prevented them from billing prescription drugs to the federal government, but that isn't what happened.
Just so I'm clear, is it against the law, or is there an impediment to buying drugs? Are people who are here illegally ineligible for Medicare Part D?
They are ineligible for Medicare Part D.
So that's just flat out wrong.
Federal health benefits, no, yeah, they're not eligible. But this comes on top of another recent report that found that Medicare's paying out benefits to dead people, too. So this problem is all over the place.
Is anybody the least bit distressed by this? I mean, it's just like, these numbers, $29 million. I mean, I suppose, people think, well, that's not $1 billion at least, but, but $29 million could change a whole community's life. I mean, a community that's in deep distress.
That's true. And of course, the administration would say that this is a tiny, minuscule fraction.
That's what makes me crazy. You know what? It's because it's other people's money. $29 million.
Right.
Well, someone is actually authorizing this, right?
Right.
Or someone's in charge. Who's in charge?
Well, what's surprising is that we haven't seen very much action out of Congress on this. Those are the people who ought to be upset, who ought to be holding hearings and perhaps passing some bills that might actually put in place some of these controls. But of course, they're focused on other things right now.
Why aren't they focused on this? I mean, why isn't Congress doing its job?
Well, right now there's so much else going on. We're governing in between crises, and they don't seem to have a lot of time.
Is there any indication with Obamacare that there's any provision within Obamacare, as far as we know, that will prevent this?
Critics of Obamacare allege that the administration has turned a blind eye to allegations of fraud and possibilities of fraud.
That's worse.
Well, we'll see. I know, because these are improper payments, but then Obamacare critics are talking about fraud within the program, people who are knowingly trying to bill. In the case of this report on Medicare Part D, these are not individual immigrants who are trying to defraud the federal government. This all happens through insurance companies. It's basically one gigantic error. But under Obamacare, what people are worried about is that people will ultimately be able to get benefits that they're not eligible for.